Hello, I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, news feeds, publications, and social media. I would like to welcome everyone to today's CHE partnership webinar, which is titled Chemicals in Consumer Products, Exposure Science at the Forefront of Regulation. Our moderator today is Steve Heilig, Director of Public Health and Education at the San Francisco Marin Medical Society and at CHE. We will leave time following the presentations for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read questions out for our panelists to respond to. We will get to as many questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Steve.
Thank you very much, Maria, and good day to everybody listening in today. This is the 15th year for CHE. We started it 15 years ago thinking that we would give it a 5-year try, and we're very pleased to be still doing this at this point. And this call in particular launches a new series that we're very excited about, titled 20 Pioneers Under 40 in Environmental Public Health. There will be 10 such calls and 2 speakers each. And this is really chosen and started to focus on and recognize some of the younger people, students and young scientists who are really making a contribution and have great potential. You may have noticed the Nobel Prizes were given out just last week. When those kind of prizes come out, they're usually of people very late in their career, actually most often retired. And so we're looking to highlight some future Nobel Prize winners in this series, if we can. The conversation today, and you can find a link to the entire series on the CHE website, is titled Chemicals in Consumer Products, Exposure Science at the Forefront of Regulation. I think it's obvious this is a very important topic. It's something that the public in particular has always been long interested in. What can they do? How can they know when something is safe or safer at least? Who to trust? How these things should be regulated? What is really going on? And so there's a lot of confusion out there, and bringing good science to this arena is very important. So very pleased to have 2 speakers today, both from the wonderful campus of UC Berkeley. And I say that because I was too. So we are going to begin with Dr. Simona Balan, who is a senior environmental scientist at California's Department of Toxic Substance Control in Safer Products and Workplace Program. So obviously very well focused on exactly what we're talking about today. Her slides are up on the webinar now. So please go ahead and start your presentation.
Thank you so much, Steve, and thank you everyone for tuning in. It really is an honor to have been nominated, and I'm grateful to get to present to you today in this webinar series. I do want to say before I start that what I'm presenting today are my own understanding, my own interpretation. It may not necessarily represent my department's. And I'm also not going to talk a lot about the problems. I think since you're here, since you're tuned in, you probably know that chemical pollution is a problem, and it's a global problem. Actually, in the past few years, there have been a series of papers that have talked about the planetary boundary for chemical pollution, that there's only so much that our planet can absorb, be it in terms of chemicals that are very persistent or also chemicals that do degrade in the environment. Even when chemicals are regulated and phased out, they are often then used in other parts of the world, leading to environmental justice problems. So this really is a global issue to pay attention to. And I particularly like a quote from the paper by Miriam Diamond in 2015, who says that as scientists, we need to avoid calling for more scientific certainty before action is taken. as this delays adoption of control measures that will help stem widespread chemical pollution. With thousands of chemicals, 100,000 substances by some estimates, it's really impossible to know a lot about all of them and to regulate all of them in a timely fashion. So sometimes we do have to act with imperfect information. And so I want to focus my talk today about these kinds of solutions, this kind of action that we can take. And I'll focus on the California example because that's where I work, but also because California, because of its size, because of its economy and purchasing power, really has the potential to impact what happens in other parts of the world as well. You might have seen this slide. We have been dealing with a legislative whack-a-mole where one toxic chemical is phased out to replaced with a similar one with similar hazardous properties, so on and so forth. And so California is taking a different approach trying to get past this whack-a-mole game. Traditionally, we have had fairly limited authority, mostly dealing with lead, mercury, arsenic, but more recently, there's been some work on copper brake pads, as well as the safer consumer products regulations. And that's what I work on right now, and that's what I'll be talking about today. Some of you may have heard about these regulations, but hopefully what I present today is going to be new, at least to a certain degree to some of you, so you can better understand what we do, how we do it, and what our needs are moving forward to really make the most out of this innovative program. So the vision of our branch is that products are made with chemicals safe for people and the environment. Our mission is to advance the design, development, and use of products that are chemically safer for people and the environment. So no small task. We are a very small group though. There's about 20 of us total technical staff. So a lot of work for a very small focus group. Our foundational questions in terms of chemicals in consumer products are whether it's necessary and whether there is a safer alternative. And these are really key questions because chemicals in consumer products are a big contributor, a significant contributor to the global environmental pollution. And oftentimes the chemicals are not necessary, or there are other alternatives or other design alternatives that could be used instead to achieve the same function. So here's briefly our framework, how things work through our regulations. We have a list of lists. We call it our candidate chemicals list. It pulls from 23 other authoritative lists nationally and internationally. And there are about 2,500 different entries in this candidate chemicals database. But some of those entries are chemical classes, like poly and perfluoroalkyl substances. There's over 3,000 PFASs, poly and perfluoroalkyl substances. So when you put it all together, we're talking about over 5,500 chemicals that are on our list that we could work on. Of course, the universe of consumer products is huge. So every 3 years, we try to narrow it down by releasing a 3-year priority product work plan. And from that work plan and from our candidate chemicals database, we come up with proposed priority products. We call a priority product a consumer product that contains one or more candidate chemicals of concern. And once we identify a priority product, we can go to rulemaking, and eventually we will be listing the priority product in the California Code of Regulations. Once we do that, then the manufacturers of that product can either stop manufacturing the product or stop using the chemical, or they can do an alternatives analysis to look at what else is available, what else they can use to achieve that same function. And so that's a very involved process. I won't talk about it today, but there is guidance on our website about how to do that. And after this alternative analysis step, we can take a regulatory response. And that can range from no response to banning the chemical to end-of-life management, or there's a lot of things that we could take. So our program is not necessarily a ban, but it's more of an integrative approach to chemical management. And it does place responsibility on the producers. First of all, manufacturers, but if the manufacturers are overseas or they're not responsive, then the responsibility moves on to the importer and finally to the retailer. So this came about, it has a long history. It started in 2006, actually, with the Green Chemistry report by Mike Wilson. Then the department issued a response to that in 2007. And eventually that led to drafting the Safer Consumer Products Regulations in 2010 under Governor Schwarzenegger, and they got finalized in 2013 under Governor Brown. And in 2014, our department issued some initial priority products, 3 priority products. I'll show them to you in just a moment. And in 2015, we started our first 3-year work plan, 2015 to 2017. So right now in 2017, we have issued alternatives analysis guidance, and we are working on more product listings, more priority products. So these are the initial priority products, in case you're wondering what kinds of chemicals and products we've been looking at. The very first one, actually all 3 of these were released at the same time, but the very first one that went into effect in rulemaking was children's foam padded sleeping products containing 2 flame retardants, TDCPP and TCP. That became effective as of July 1st of this year. We are now working on finalizing the rulemaking on spray polyurethane foam systems with methyl diisocyanate or MDI. And next in the queue are paint strippers containing methylene chloride. So these were the initial products that the department issued basically as soon as the Safer Consumer Products branch was formed. After that, we established the 2015-2017 Priority Products Work Plan. So these are the consumer products that we're focusing on right now. Certain building products, furniture and furnishings, cleaning products, clothing, beauty and personal care and hygiene products, fishing and angling equipment, and consumables for office machinery. So it's quite a big range of products. And from these, we have focused on 3 main areas that we've had workshops about earlier this year. The first was aquatic impacts. That's one of our policy priorities through this work plan. We've looked at aquatic impacts of nonylphenol ethoxylates and triclosan, and we continue to investigate the use of nonylphenol ethoxylates in certain consumer products. We've also looked at certain chemicals in nail products from the perspective of exposure to nail salon workers. And we also looked at perfluoroalkyl and polyfluoroalkyl substances, or PFASs, in carpets, rugs, upholstered furniture, and their care and treatment products. And as I mentioned before, this is a really large class of chemicals. There's about 3,000 of them, according to recent estimates. And we've been looking so far at the entire class in our workshops and stakeholder engagement. And last but not least, we've also been mandated by the governor and the legislature to look at lead acid batteries. That's actually a current focus of the department. Lead acid batteries account for over 90% of the current use of lead in California. So we are considering them as priority products potentially. So how do we select these priority products, you may wonder? Our regulations give us a lot of discretion. Really, we only have to meet 2 main criteria. There's 2 prioritization principles. We have to show that there is potential exposure to a candidate chemical in a consumer product, and we have to show that there's potential for those exposures to contribute to or cause significant or widespread adverse impacts. And the department gets to decide what significant or widespread means. We have a lot of flexibility in terms of implementing these. The regulations don't go into any more detail about this. They do, however, list several different exposure principles and adverse impact factors that we look at, but we only need to meet a minimum of 1 of each of these principles. We don't need to meet all of them. We do, however, look at the entire life cycle of the product. So the exposures or the adverse impacts don't have to happen from the use of the product. They could happen during manufacturing, they could happen during disposal, they could happen anywhere along the life cycle. They also don't have to happen to humans, right? Our regulations consider equally impacts to humans or biota or the environment. In practice, however, this looks a lot more complicated. It's an iterative process where we basically take the big amount, the possibilities, thousands of options there, and we focus it down to a handful that we can actually focus on in every 3-year work plan period. So we start with our candidate chemicals list and our work plan, then we scope the chemicals that relate to our policy priorities for this period, then we scope products, we do initial public engagement, we research more specifically, then we have more public engagement, and eventually we move on to rulemaking. All right, so we are working on improving this, improving our process, because there's definitely room to grow in terms of our effectiveness. But there are a lot of challenges in decision making. First of all, I really like this metaphor of, we have thousands of doors, thousands of choices that we could make that seem, fairly equally good in the eyes of our regulations. But we don't know once we open that door what we're going to find behind it. Is it going to be meaningful? Is it going to be possible? What are going to be the consequences? What regulatory responses can we take? We have no precedent, right? Our regs are unique. There's no precedent anywhere else where we could go and learn from. So we have to invent or create everything as we go. Also, our regs are pretty complex. So there are principles that we have to prove, but there are a lot of other factors that we can consider. Also, our regulatory framework differs from traditional expertise. Traditionally, there's a lot more focus on toxicity and risk assessment, whereas under our regulations, we could rely, for instance, only on persistence or only on bioaccumulation. We don't need a lot of data on toxicity in order to prove the adverse impact factor, as far as our regs are concerned. We also don't need to show direct exposure from the product. We can just show that the product contains the chemical and that there is exposure in the general population based on biomonitoring studies. But we do want to try to understand these potential exposure routes better, just to get a sense for how meaningful the work that we do is, how meaningful a certain product choice is. There's also a balance of science and policy that we have to consider to focus on our policy priorities. So taking all of these into consideration, it can be quite a long and challenging process. And we do need something that is compelling in order for it to withstand through the regulatory process. The regulatory process can take a while, and we really are too small to afford to not choose wisely. Whatever choices we make, they have to be meaningful. They have to be very well researched. And of course, we work in a world of limited information availability. So how can you help, right? We really need the support from our public, from our stakeholders, from our community to make these regulations meaningful and impactful for the people of California and beyond. So the most basic thing that you can do, the easiest one, is to join our e-list, to stay in contact with us, to attend our workshops and provide input whenever we request it, be it at our workshops or on documents that we post on our information management system, CalSafer, and you can see the link here at the bottom for CalSafer. If you are a researcher like Todd, who works on exposure data, if you have epidemiological data, biomonitoring data, or other exposure data related to consumer products, we would love to hear that, perhaps even set up collaborations for the future to prepare our next round of priority products. You can also nominate product categories. So right now we are preparing the next priority product work plan from 2018 to 2020, and we are going to soon open on CalSafer public comment period where you can nominate product categories for us to include in the next work plan. You can also tell us if you want us to remove any product categories that were in the previous work plan, not to carry them over. If you think there's no need for that, you can also say that there. And of course, you can nominate priority products, right? If there's a chemical product combination that you think is important to address, then please nominate that as well during this period. Also, at any point, if you have the time and the resources to do that, you can submit a petition. And a petition basically circumvents all the work that we do internally. If we accept the petition, we can go straight to rulemaking. a petition has fewer limitations than we do in our work, meaning that you don't necessarily have to restrict yourself to a product that fits into the categories in our work plan. You could really petition us to consider any chemical product combination. However, a petition does need to be very thorough, very well researched, very compelling, because that's the standard that we need for rulemaking. So please continue engaging with us. I think that together, if we really work together, we can ensure that our shadow is bigger than our shape, and we can really make these regulations effective. So thank you for your time, and I'm going to turn it on back to Steve and Todd.
Thank you very much for that presentation, showing a lot of both expertise and inspiration. That's a very nice slide there at the end there too. I like the cat. We will turn now to Dr. Todd Whitehead, also of UC Berkeley. He is an exposure scientist, has focused a lot on children's exposure and issues and measurement. And you'll need to, you've unmuted yourself, so please go ahead, Todd.
Okay, hopefully everybody can see my slides. Thanks, Steve, for the introduction. I'm talking to you today from the Center for Integrative Research on Childhood Leukemia and the Environment, and I just want to start with a little bit of an overview of our center. So our research objective is to discover the environmental risk factors for childhood leukemia. We are in the second cycle of our funding. We were initiated in 2008, and in the current cycle, the approach that we're using is really focusing on the in utero period of exposures and trying to use innovative exposomic methods to identify risk factors that haven't been evaluated before for childhood leukemia, things that haven't even been considered before, as well as identifying the mechanisms that underlie environmental risk factors for childhood leukemia, whether they're things that already have been identified or the new things that we're coming up with in this cycle. And really our overall mission as a center is to try to intervene to prevent future incident cases of childhood leukemia. And in that way, we're really very well aligned with the mission, the vision, and the values of the Collaborative on Health and the Environment. So the presentation, my presentation theme is sort of how our circle research can provide a chain and link up the chain between consumer products and health impacts so that regulators can be empowered to affect manufacturers and change the way that chemicals are being used in the United States. So I'm envisioning 3 links in the chain that I want to talk about during my presentation. The first link in the chain is between consumer product of interest and the contamination that product causes in the home environment. The second link is between that contamination in the home by toxin and actual human exposure or biological intake of those chemicals by the people who are living in the homes. And then the third link is between that human exposure and an adverse health impact that the exposure causes. So there's essentially 3 research domains that allow us as a center to try to fill in those gaps or link those pieces of the chain. The first domain that I want to talk about is environmental forensics, which is like looking at what's in the environment and trying to figure out where it came from. The second domain, the second link there is environmental sampling and biomonitoring. That's going to allow us to make connections between what we find in the home and what we find inside people. And then the third link in the chain, the third research domain, is epidemiology, environmental health, where we're actually trying to make connections between what the exposures are and what the health outcomes are that we can observe. So the case study that I want to talk about is polybrominated diphenyl ethers in furniture as an example of consumer product. So there are 2 commercial mixtures of PBDs that were used most heavily in the state of California. One to treat polyurethane foam and upholstered furniture primarily, and that's Penta BDE mixture. And the other is the Deca BDE mixture, which was used to treat electronic housings for televisions and computers, along with other applications. And in California, we have a very unique situation, which is the result of having this Bureau of Home Furnishing and Thermal Insulation and the requirement Technical Bulletin 117, which asked producers of furniture to make sure that the polyurethane foam that they were using in their furniture could withstand 12 seconds of open flame from a candle. And this sort of unique requirement really led to a lot of heavy use of chemical additives as flame retardants in furniture in California, ostensibly to slow the spread of fire. But the concern, unfortunately, is that PBDs are structurally similar to PCBs, polychlorinated biphenyls, and they have a lot of the same problems that PCBs have had before. They're persistent in the environment, they're bioaccumulative in the food chain, they have long half-lives in humans after exposure, and there's a potential for mobilization of these additive flame retardants from the consumer products in which they're used into the environment, which is the big concern for us. The good news is that PBDs have been phased out, but again, this is just sort of a case study to show how we can use our research to inform the regulatory framework. So the first link in the chain, the environmental forensics, or looking at, in this case, PBDs in household furniture and trying to figure out how those PBDs might get into the home environment. And specifically, I'm going to talk about our work measuring PBDs in settled house dust. So the rationale for using settled house dust as a marker for the contamination that's in the home is that dust is a really great reservoir for persistent chemicals. So dust has a organic component, and that organic component really wants to attach and it wants to glom on chemicals like semi-volatile organic compounds, persistent chemicals like PBDEs, and then these chemicals remain in the dust particles and get trapped in the carpet where they're sort of semi-permanent reservoirs of these chemicals in the home, and then people can be exposed to them over time. So in our center, what we did was to collect dust samples using vacuum cleaner bags and vacuum cleaner canisters. So these were samples that were coming from routine vacuum cleaning in over 500 center homes. And some of these homes were sampled more than once at intervals of multiple years. And our plan was to look to try to identify the sources of the contamination for chemicals, including PBDs, using forensic microscopy as well as interviews with the participants. So here's an example of some information that we could get from an interview with a participant. We're asking the people, in this case, about the condition of their furniture. We had the hypothesis that people with crumbling or exposed foam on their upholstered furniture would have a more ready migration of the flame retardants from the furniture into the home environment. And this is exactly what we saw in our data. So when we looked at the levels of PBDs and the settled dust collected from the household vacuum cleaners, we saw that people who reported having pristine furniture in the left box plot there in your figure had lower concentrations of, in this case, BDE 99 is what I'm showing, than the people who reported having crumbling or exposed foam in their upholstered furniture. And this was the case not just for BDE 99, but for all of these PBDs that are included in that penta-BDE commercial mixture, which was used to treat polyurethane foam in California. So BDEs 28, 99, and 153 as well. And this is just sort of some evidence that indeed there was a potential for PBDs to migrate from consumer products into the home environment. We could look at this also using forensic microscopy. So we're looking here at images from scanning electron microscopes. This was work that we collaborated with the California Department of Public Health to accomplish, specifically microscope experts Jeff Wagner and Sudipha Gosal. So what we could see here in the middle panel is the elemental composition of one specific particle of dust that we found in a dust sample from a vacuum cleaner in a house that was participating in our center. And we can use this scanning electron X-ray diffraction technique to look at the elemental composition of individual particles. And in this case, we're showing the bromine in blue in that middle panel. And you can see the little pieces of bromine that seem to suggest that there's a flame retardant on that particular particle. And then we can use a different microscope with a Raman capability to actually resolve the chemical composition, not just the elemental composition, but the actual chemical composition into the individual components that make up the particle. So you can see in the right panel, there are these different spectra that relate to the different components of the particle. There's a polyethylene plastic matrix, that's the bulk of the particle, and then there are these inclusions of BD209 or deca-BDE as the flame retardant. As going along with that, there's also antimony trioxide, which is a common flame retardant synergist that's used alongside deca-BDE, and then the other peaks correspond to this coloring agent, which is why the particle shows up white in the inset picture there. And then if you go to the left panel, you can see that in an optical microscope, there's a distinct morphology to this particle as well. It kind of looks like a little chip of plastic. It's got angular sides to it, and it's really suggesting that there was a transfer mechanism that was probably abrasion or weathering of this piece of plastic off of some sort of consumer product, and that's how these flame retardants moved from the products that they were used to treat into the home environment where we found them. So now we're going on to the second link in the chain, which is to connect the contamination that we see in the home to actual human exposure. So we're looking at PBDs and settled dust, and then biomonitoring data of PBDs for the people who are living in those homes. So as I said, there are these unique flammability standards in California, which have made it so that there are really high concentrations of PBDs and dust from California homes. That's something that we've certainly seen in our center, but other studies have seen it as well. And the concern is that with these really high levels of PBDs, young children who spend a lot of time on the floor and also spend a lot of time putting their hands in their mouths with toys or just by themselves with their hands have a potential to be exposed to these chemicals in the dust. So if this hypothesis is real, and if there really is an exposure route there, then we expect to see higher levels of exposure for the children in these homes than for their adult counterparts. And that is what we saw with our data. So here are the median levels of 4 different PBDs in children from our center and also their mothers who were participating in the study. And these are levels in biological samples in blood. And you can see that indeed the children have about twice as high levels of these PBD exposures as their mother, which seems to be indirect evidence that there is a real exposure route here where the children have higher body burdens of PBDs than their mothers due to the accidental dust ingestion. There's a more direct way of evaluating this relationship between the contamination in the home and what's in the body. We can just look at, for one individual, the level that we find a PBD in the dust and then the level that we find in their body, and compare across individuals to see if there's a trend. And we did this for patients who had leukemia, young children, using a small volume of diagnostic blood that was left over from their initial diagnosis of leukemia. This was a convenient sample that was available to us, and we compared the levels of BD153 that we found in this small volume of blood to the levels of BD153 that we found in the settled dust from their homes, and we saw that there was a correlation. We did the same kind of thing with the mothers that participated in the center, and you can see the same sort of relationship. Here we're talking about dust levels of BD47 and serum levels of BD47 for the moms, where we had 1 milliliter of serum collected after the child's diagnosis with leukemia. And again, there was a correlation, a significant correlation between what was in the house in terms of the contamination and what was in the mothers in terms of their exposure or their body burden. So again, that was more direct evidence that there is a relationship between that second link between what's in the home and then what's actually people are actually being exposed to. Okay, and now the final link is the epidemiology, where we actually look at how human exposure to PBDs is related to health outcomes or health effects. And in our case, we're interested in looking at childhood leukemia. So we want to see if PBDs are risk factors for childhood leukemia. And so in our center, we've spent a lot of time and a lot of effort, both using our California populations and collaborations that we have with investigators from around the world and an international consortium that we have as part of our center to try to identify risk factors for childhood leukemia. So these are sort of the 4 most consistently observed risk factors for childhood leukemia. There's exposure to traffic-related air pollution after birth. There's parental smoking before birth, exposure to household paint after birth, and then exposure to household pesticide use during pregnancy. Those 4 factors can account for about 25% to about 30% of the incident cases of childhood leukemia. Obviously, there are a lot of other unknowns, and that's a big focus of our center to try to identify what these other unknown risk factors are. So PBDs are one thing that we've considered using the California Childhood Leukemia Study, which is a long-running case control study that was initiated in 1995. We enroll cases when they're diagnosed with leukemia at local hospitals, and then we use birth certificates to find match controls. We have case and control families fill out questionnaires with information that we think might be relevant to childhood leukemia, including the items that I just talked about on the previous page, things like smoking and pesticide use. And then we have these dust samples that I've been talking about, which we have available from a subset of the homes in California. And we just basically want to compare the level of chemicals that we see in the case homes to the control homes, adjust for the pertinent contextual factors, and then see if there's evidence that the case homes seem to have higher levels of these chemicals. So when we do this kind of analysis for PBDEs, we do see that these particular 4 PBDEs seem to be higher in the case houses than the control houses. Specifically, if we compare the highest tertile of exposure to houses where there were no detections, we see an increased risk for PBDs 203, 206, 207, and 196. So our conclusion is that PBDs might be a risk factor for childhood leukemia. We're trying to follow up on these epi observations by doing some more basic science. We're looking to evaluate the mechanisms that might be underlying this observation, including epigenetic changes and abnormal immune development during the in utero period. And we're also trying to use controlled experiments, looking at a mouse model of a subtype of leukemia, where we're exposing the mice prenatally to PBDs, and then looking at changes in epigenetics, immune development, and the propensity for leukemia development. And finally, we're trying to identify specific windows of susceptibility to PBD exposure, whether it be the in utero period or after birth or even before conception, perhaps. So just to wrap up, we heard Simona talk about TDCPP in the first presentation, and we have talked a lot about PBDs in this presentation, but we have also done some work in our center and in collaboration with the folks at the California Department of Toxic Substances Control, and with my former student, Beverly Shen, who's also at UC Berkeley, and Commonweal's own Charles Patton. We've done some work with organophosphate flame retardants as well, including TDCPP, and considering sort of a unique part of the life cycle of these chemical products, which is what happens if they are present in a fire event. So we have reported that BD209 levels are really high in fire stations, dust from fire stations, and now we're also finding that TDCPP levels seem to be higher than they are in other occupational and residential settings. So our conclusion is that these firefighters seem to be exposed not only to flame retardants at fire events, but potentially in their fire stations as well. So I want to just wrap up and thank my collaborators who have contributed to all the work that I've discussed today, the folks from the California Department of Public Health, California Department of Toxic Substances Control, as well as my collaborators from NCI. I'd welcome any questions. I would just like to point out that you guys are welcome to visit our website. There are tips there for trying to avoid chemical exposures at home, and all of our latest research is shared on our website. And you can also follow us on Twitter. This is a new thing for us. We just started our account this week, but we're very excited to try to engage and interact with people on Twitter. So if anybody here has a Twitter account, you could find us at @circle_UCB.
Thank you very much for that. Excellent presentations, most impressive. One thing I noticed in both of your talks is you seem to be doing a fair amount of participatory type research. You work directly with the subjects in getting samples and talking about their various risk factors and so forth, which is, you know, a relatively newer trend in this field. Is that a conscious decision you make? It's actually essential to your work, it sounds like.
Well, for us, definitely it is essential. we can get a lot of information from the participants. We have some studies that are registry-based, where there's far less participation, but we don't get as much rich information about the environmental exposures that the people in the study are experiencing in those registry-based studies. Interaction allows us to get much more detailed information about what sort of exposures people have. And the other part of the interaction is that as a Children's Environmental Health Center, we really have a call and a responsibility to do outreach and research translation of our findings back not only to the people who are participating in the study, but to the general public. So that's something we try to take really seriously.
And I'm, excuse me, I'm wondering, both of you being in California, do you feel that California is actually still, or is a leader in this general realm that you're both working in, or is it, I mean, we like to think that California leads the way in many different things. And it seems to me that there's a lot going on here with the department, both public and privately. I mean, do you feel that you're ahead on the regulatory and science fronts?
I would say so, yes. I think definitely California is ahead. The safer consumer product regulations are pretty unique and in many ways revolutionary. I mean, it is an approach that hasn't been tried before that has great potential. So that's why I'm really happy to be working here, to be a part of this.
Have you looked at what's happened with the relevant regulations and scientific work in Europe? It started with REACH years ago and is very slowly progressing, but is that something that you seek to emulate or use as any kind of benchmark?
Yeah, we collaborate with other researchers and regulators from Europe and from other countries. Depending on what work we do, we all have our networks of collaborators from other parts of the world, and there's definitely a lot to learn from Europe. But there's also many ways in which our regulations are different.
Right.
We have to find our own way.
Todd, it looks like there's a question here for you. I believe it is. It's perhaps I missed it, but in your leukemia study, do you also look at time in residence to get a perspective on duration of exposure and plausibility of association?
Yeah, that's a good question. Specifically with the dust samples, that is an issue. We try to use participants for the dust aspects of our study that make the most sense. So we're looking at children who are below a certain age to get the kids who have the most likelihood of having hand-to-mouth exposure and proximity to the floor. And we're also looking at people who have been have a certain amount of stability in their home since the diagnosis period. So there is a sort of minimum amount of time in residence that we have imposed in that part of the study.
Great. Well, we are up on our time, our time here at 10:45. I do not see more questions either on the Chase site or on Zoom here, but I think people would still be welcome to post a question on here or to ask it there, and we'll check back and see if they may have an answer for you. I really want to thank you both for the great presentations and to congratulate you on being chosen among the 20 younger scientists coming up. So thank you very much again for joining us. I will say that those choices were made by a group of esteemed scientists in the field. So these are peer-reviewed awards, as it were. So with that, I will turn it back over to Maria and sign off here. Thank you, everybody, for listening in.
Thank you very much, Steve. So we are approaching the end of our webinar today. A video recording of this webinar will be available on the CHE website soon. Tomorrow, you will receive an email containing a link to the video. CHE's next partnership webinar will take place next Tuesday, October 10th, and is titled Breast Cancer and the Environment, State of the Evidence 2017 and Directions for Future Research. To learn more and to RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers once more for taking the time to present today, and Steve for his excellent moderation. Thank you very much for joining us, and have a great day.